glasses.
Oh, okay, thanks.
Good evening, everyone. All the applause for you.
No.
I'm Paul Ramsey. I'm the Chief Executive Officer of UW Medicine, and I am delighted to welcome you to this town hall with Senator Maria Cantwell. This is democracy in action. And the topic for this evening, health and health care, could not be more timely. I have been in medicine for more than 40 years, and I can tell you from my experience, it is the most exciting time in human history for health and health care. What we can do in research is beyond belief. Education is fascinating, but it's also a very challenging time. And the challenges, of course, I expect you will have questions about what we are doing. It is definitely a challenging time for the provision of health care to create access for health care in particular. And this evening, I will serve as moderator for Senator Cantwell, and we hope to really address the questions that are on your minds about how we can improve access and improve health and health care in our country. Before we begin and before I introduce Senator Cantwell formally, I'd like to just go over how we would like to handle questions this evening. There are staff from Senator Cantwell's office scattered around. Can you all raise your hands?
I'm going to get you a microphone.
Not scattered yet, but we'll be scattered. You should have raffle tickets. You have raffle tickets? Mm-hmm. Good, good. We will be, or I will be drawing tickets. I'll draw two at a time and announce those numbers. A staff member from Senator Cantwell's office will find you and be available with a microphone for you to ask your question. This town hall tonight is about health and health care, so I ask that you do ask your question about health or health care. To enable as many people as possible to speak, please keep your questions brief. Please be respectful. Please focus on health and health care. We will not be able probably to have everyone with a question come to the microphone. At the end of the town hall, there will be cards outside. If your question has not been asked during the town hall, you can write it down and leave it with one of Senator Cantwell's staff for addressing at a later time. So that is the basic plan for how we will seek your questions and your input. Now, although Senator Cantwell asked me to really not introduce her, I can't do that, I'm sorry. I really need to say just a few things. I've had the privilege of knowing Senator Cantwell for a few years, and she has been a strong supporter of health and health care. Healthcare research, education, and healthcare itself. She, of course, is a senior member of the U.S. Senate Finance Committee, and that committee oversees a significant amount of the U.S. healthcare system, the Medicare and the Medicaid program. As part of that committee in 2009 and 2010, Senator Cantwell played an active role in passing the Affordable Care Act. And she was the principal architect on a provision in the bill called the Basic Health Plan. This increases access to affordable health coverage by letting patients buy insurance in bulk. And I believe that during her entire career, Senator Cantwell has been a very strong advocate and a defender of all aspects of health care, and especially the Medicaid program, which is so important to citizens of the state of Washington and citizens of our entire country.
Thank you.
So with that, please join me in one more round of applause for Senator Cantwell, and then we'll start the questions.
What are we doing up front?
Thank you.
What,
I am not being an appropriate moderator. I have it placed on my script, and I forgot. I'd ask you all to stand just before we start the questions and pledge allegiance to our flag. Please follow me. I pledge allegiance to the flag of the United States of America and to the republic which it represents,
one nation, under God, indivisible, with liberty and justice for all. Thank you. Well, thank you, Dean Ramsey, and welcome everyone. Thank you for making time tonight to come on a beautiful Northwest evening to talk about such an important issue, healthcare and access to healthcare. I want to thank Dean Ramsey and UW for hosting this event and for his steadfast interest in this issue, because I can tell you when it came to the Affordable Care Act and many other pieces of healthcare legislation, we rely on them a lot for information and statistics and data. People should know that the University of Washington produces more primary care physicians than just about any place in the United States, and we want them to do more. We want everybody to have a medical home, and we want them to be seen by a primary care physician. So thank you, University of Washington, for that leadership. There's so much aspects that I would love to talk about, but we're going to get to questions, and so I'll just try to weave that in to tonight's conversation so I can hear what's on your mind. But just know, when I go to Washington, D.C., I fight for what we have here in the state of Washington, for the innovation, for the ideas, for the things that we've been able to successfully achieve in healthcare that really should be the model for the way the rest of the country should do business. So I just thank you for that opportunity to go there and to fight those battles and to try to advocate on behalf of us. I think that tonight we're going to have a great discussion, and I look forward to hearing your questions and comments and advice. If anybody has any for the Seattle Mariners, I'm happy to hear it. But thank you all very much, and let's get started.
The first two numbers are 914191. Raise your hand.
Everybody has to look at their numbers.
If you could raise your hand, and if you're seated in the middle, move out to the side.
Read another one.
Second is 133657.
If you could say your name.
Oh, okay.
You can say your name and where you're...
a very serious question. And my name is Cynthia. I'm a longtime activist in Seattle. I have a comment and a very sincere and important question about what you're going to do about this fascist regime cabal that's in power in this country. And I don't use that term lightly. They're on their way to cause massive destruction to the planet, and I don't think there's an elephant in the room here. We know what this regime is doing to the planet, to poor people, disabled people. He already dropped a huge bomb, and he's got his hands on the nuclear trigger. We're talking about Trump. I would like to see if you are willing to call out these people as the fascists that they are, and to actually take a stand very vocally, very, very vocally, on the side of oppressed people around the world and here. And try to do that, as very few politicians are doing. We have to rely on ourselves fundamentally and get millions of people in the street to drive out this fascist Trump regime. Everybody come out on July 15th, 19th. Excuse me, I'm a little anxious because there's so much at stake here, but July 15th is a national protest. You should be out there too, Maria, calling for people to get in the streets and drive out this regime as soon as possible.
Thank you.
Not waiting, no waiting.
Well,
For the elections.
So thank you, Cynthia. And listen, I know there is a lot of frustration with this administration, and believe me, I have to show up every day and fight against the policies that I think will hurt our state. And for the first half of this year, believe me, it was every single day, okay? Whether that is trying to roll back the regulations on clean water and saying that coal companies can go ahead and pollute, whether that was the methane rule where people said they could burn fuel and burn it into the air, whether it's on important issues like making sure that Hanford is cleaned up. You're right, every single day is almost shock and awe of what this administration is proposing. And so we try to fight, and I'm trying to do everything I can to hold them accountable. Do I believe in the 2 investigations that are going on? Absolutely. Do I believe in a lawsuit against the president in the emoluments clause? Yes, absolutely. So I'm going to continue to fight. I'm going to continue to fight to hold this administration accountable, but every day there's votes. And like that one vote on the methane rule, people didn't give us a chance, but because we fought every single rule, this was rolling back rules by a simple majority vote. But we made our case, and it's the only rule that the president tried to roll back that we were successful in defeating him on. So that's what means showing up every day you can do. I stopped that level of pollution from continuing in the United States of America. So I'm going to keep showing up and doing my job and fighting against them.
What?
Are you going to call these politicians out and not remind them?
Could I ask that we stick with the questions here? The next number will be 133664.
Yeah.
And let me call out another one so we could have that person ready. 133671.
Hi, I'm Tom Dickerson. I'm a physical therapist, and I work in a hospital here in Seattle. And my question is about hospitals. Right now, in the 19 states that declined the Medicaid expansions, hospitals, especially in rural areas, are closing at epidemic rates. And while they're doing okay in the other 31 states, if this ACA repeal goes through in every iteration that I've seen so far, that will happen across the country in all 50 states because they'll be taking away the reimbursements for Medicaid that these hospitals need. And what I hear a lot about the 22, 23, 24 million that won't get insurance, and that's important. It depends on which CBO you're looking at for which bill. But another huge issue is the millions of rural people who will, whether they're insured or not, are going to lose their access to emergency care. And so we hear about the thousands that are dying, that will die, that are predicted to die because they've lost their coverage, but we don't hear about the thousands that are predicted to die even though they have coverage, that are going to lose access to their hospitals, that'll go under if these law goes through. So what are you doing to get these people who are pushing this bill to because I don't hear enough about that, and what are the Democratic senators right now doing to push that part of it, because I feel that could be a really resonant part of stopping this if we can get that enough publicity for that issue also.
Well, thank you for that. Thank you. You're right. It's a very hard challenge to try to figure out how to constantly illuminate these issues so that our colleagues will just see they are dead wrong about this. And you're pointing out about how the rural infrastructure won't be supported and they will go under. Now, I know that we've encouraged these healthcare providers to write letters to their congresspeople as well, to write letters to the newspapers and to the chambers of commerce so that they will see that no one will want to come and have a business there in that community if you can't get access to care. So I think the undermining of the healthcare system when you take money out, so in the central part of our state, literally, you're talking about it can be as much as 60% of the healthcare is delivered Medicaid, Medicare population. So when you take this amount of money out of Medicaid, you are basically leaving that community without the ability to operate those facilities. And then as one provider told me in the eastern part of our state, literally, you're going to just rise everybody else's premium costs because people are going to everything is going to be more expensive. So we know it's not going to help us keep down rates in the individual market. We know it's going to economically challenge those communities. In fact, here's a statistic for you. Every state that did a Medicaid expansion has had an improved GDP because of it. Think about it. Think about it. It's giving people access to health care so that they aren't coming into an emergency room and costing more. We heard in one county that this one individual was, had been in 50 times to the emergency room, and that is what was costing them. They got this person on Medicaid and stabilized the cost because now that person wasn't coming in constantly as looking for their doctor in the emergency room. So what I've tried to do is I've been everywhere in our state talking about this, getting the provider community to raise their voices so that the larger community will be there. And I've gone to the Senate floor numerous times. I'm begging my colleagues to come debate me. They have this idea on repealing the Affordable Care Act. Come debate if you really think it's a better idea. But so far, the only time people come down there to debate is to say to repeal the Affordable Care Act. They do not come down and debate on these issues, and they should.
I'm Leanne Kennedy, and I'm a mental health therapist, and I just have to say that we've seen an increase in clients due to the anxiety of this administration. But my question is, are the Democrats in Congress going to present a plan that will repair the Affordable Care Act rather than repeal it?
Yes. Yes, and we so want our colleagues on the other side to embrace these ideas because I think they're great ideas. One of them is the basic health plan. So how many people remember the basic health plan from when we had it in our state? Anybody here was on the basic health plans? A couple people in the back, thank you. So what the basic health plan was able to do was bundle people up because if they were in the individual market, they could get clout and bring down the rates just like if you worked for a larger employer. That's what was great about it. I call it the Costco model. When you buy in bulk, you should get a discount. Okay, so when the Affordable Care Act came around, I said, this is a provision that worked in our state, worked successfully at driving down the cost. Guess what else it did? It allowed the state to negotiate on drug prices. Okay, that was a very key provision. So I can tell you I worked months and months and months to get the basic health plan into the Affordable Care Act. The big challenge was that when we finally got the law implemented, there was so much focus on the exchange that the rules did not come out to do the basic health plan till very, very late in 2015. So 2016 was the first year that any state in the nation could do the basic health plan. Well, so what's the result? The state of New York The state of New York has 650,000 people on the basic health plan getting more affordable insurance today because of that provision. So, what's the difference? An individual there who is above the Medicaid rate but still at 200% of poverty has to basically, instead of buying on the exchange, let's say the exchange, this family of 4 probably would have paid $1,500 for their premium. In New York, they're paying $500, okay? So it's affordable insurance, and they had a huge uptake. Practically everybody who came into the marketplace to look for insurance, everybody said yes. Why? Because it was an affordable price. So you bet right now I'm fighting with every one of my Republican colleagues to sit down, look at the success of this, look at what happened in New York. I'm saying to our state legislature, there should be no county in Washington that can't afford insurance. We should have the basic health plan back in Washington state. So that's just one idea, but we'll save it. Let's go to some more questions.
Two more numbers, 913-283.
Call out a
And a second number, 133660.
Hi, my name is Sue. I am here representing the indivisible group. See, I can talk tonight. What is repeal and replace really going to mean, especially for our state?
Could you say the first part again?
What will repeal and replace later really mean for our state?
Well, first of all, we cannot repeal. We just cannot. Look, we had expansion of Medicaid. The expansion of Medicaid, as I addressed to that gentleman, brought everybody's, the GDP of those communities up. It provided access that helped lower everybody's cost. It put downward pressure on other people's cost. So those are states that expanded Medicaid. In addition, the fact that they want to capitate Medicaid, I'm not going to go right now into the big discussion of that, but I can just tell you this, it's nothing more than cutting people off of health care, and we're not going to do it, okay? So when they say repeal and replace, they're talking about trying to move out this date and say in the future, this is what we're going to do. We can't throw that many people off of health care. That's not a wise thing to do. We need to give access to health care, and that is why we're going to go back to our colleagues and say, there are good ideas here for us to pursue. That's what we should be talking about. Thank you.
I'm Jeff Johnson, Auburn, Washington. Jeff Johnson, Auburn, Washington. I'm a founding board member of Christ Community Free Clinic. We've been open for 10 years. Before the Affordable Care Act, there used to be lines and we turned people away. But now that people have insurance, there's a lot more people that have found a medical home. My question is, how do we get to a bipartisan agreement on health care? Medicare was passed with 75% in favor. During the Bush administration, the Medicare Modernization Act was almost defeated by Democrats. And during the Obama administration, the Affordable Care Act was against Republicans 100%. So we have to come to a middle ground somewhere. What do you think we can do in that?
Well, I'm continuing to advocate that there are things that are working. A lot of this debate has been centered on the individual market and what's happened in the individual market. I just gave an example of a great way to address that in a pretty significant way with the basic health plan. So I'm always confused about why, if there are some issues in the individual market, do people want to either get rid of the Medicaid expansion or capitate Medicaid? What does that have to do? It's only going to exacerbate the individual market. So I think what we should do is go back and focus on the individual market and what are some of those challenges and what we can do to fix that, and quit beating up on Medicaid. That's what I think we should do. And I will just add that I think that while some people would say, oh, you can't convince your colleagues of that, I think that is exactly why we're at this point right now without having them pass repeal. Because I think that some of my colleagues know darn well that Medicaid has provided great care, and it is why you see people in your clinics. And there are Republican governors around the United States of America who've also seen the benefits of this, and they've advocated for it. So quit beating up on Medicaid. Let's go back and talk about the individual market. Okay.
Two more numbers, 913-279. 913-279. And a second number, 133654.
Hi, I'm John Jarrett from Seattle, and I really want to thank you for coming tonight. It takes a lot of guts. Appreciate that.
Thank you. Thank you.
And sort of the other side of the coin, I'm really interested in what it is you think that we can do for you. How can we show that we back you up in this big fight?
Well, so many people have shared individual stories, and I use those stories to go to the Senate floor and talk about that. Clearly, you guys are making your voices heard all across the state, and that's very important to continue to do. And I think for us, it's focusing on just even letters to the editor and communication about why this system is so important. Now, I will just say that when this whole battle started, somebody said to me, oh, Maria, you'll never be able to get the public to understand that capping Medicaid is a bad idea. And that is the day I decided I'm going to put every ounce of energy into this fight, because it's a really bad idea. And if you can help me go communicate that to other people, then I will be forever grateful, because this is what they're trying to do. They are trying to take a budget mechanism. It's not about a medical home like we're talking about here at UW. It's not about primary care. It's not about innovation. They are trying to say, Mr. Ryan's idea, to cap Medicaid and continue it on a downward slope, even though we know there's going to be a population of baby boomers who are retiring. So that capitation of Medicaid is just going to pull money out from under people, and people are literally going to be pulled off getting coverage. So the challenge that provides, so some of my colleagues, well, we'll make up for that on opioids. Say Dean Ramsey had a community clinic and he was seeing people with opioids. And now, because you're the senator from West Virginia, you got $45 billion more in this bill. And you said, okay, Dean Ramsey, we're going to give you $2 billion more. Now we should vote for this bill. No, because the first thing that Dean Ramsey is going to say when the people knock on their door with an opioid problem is, do you have Medicaid? And when they don't, you're not going to get into his clinic. So what we have to do is keep fighting this battle, if you can help in any way, to communicate to the broader public that we're on to this. We're on to this. We know exactly what capitation means. It is not innovation. It is cutting people off of health care, and we're not for it.
Veterans are the dream that Black Lives Matter can believe in. Our veterans that fought to make this country safe, free as it can, sleeping on the street. Right now, today, for that speaker, I'm looking at 2010, where 11.2 million unauthorized, undocumented aliens. And then in 2015, 42.1 million, and the war going on in Afghanistan and Iraq. That's meaning that the violation of organized crime control, October 15, 1979, that was signed by President Richard.
Thank you. Thank you, sir.
Control Act of August 24, 1954.
Thank you. I'm going to ask. Thank you.
Thank you, sir.
Won't you shut up in my neighborhood? Yeah, you shut up in my neighborhood.
Thank you.
Thank you. Let me ask the person with 133658. 133658. And while the microphone is going up there, also 133659. Even though it's a lottery, the numbers are close.
I only came with one question. Hi, I'm Becky Bisbee from Bellevue. Thank you, Senator Cantwell, for coming, and everyone else. My question has to do with Medicaid and people with disabilities, and I wonder if you will support Senator Schumer's Bill 910, the Disability Integration Act, which supports putting people with disabilities in the community-based programs as opposed to institutions.
Well, we definitely, I don't know the details of that particular bill, but we need to make sure that we have community support for individuals, and we need to make sure we have inpatient support as well. Who's next?
Next number would be 913291. A winner. 133681.
I apologize for the way I'm dressed. I never win anything.
Well, I wish it was something.
Well, no, this is
I hope your luck keeps going.
my yellow dog Democrat mom in heaven would be so proud right now. I have a brief comment. My husband just completed the fourth treatment of a stereotactical ablation body radiation therapy. I'm sure Dean Ramsey knows this. And this instrument is an amazing incorporation of physics and healthcare, where it incorporates millions of pieces of information, and it uses that to go around the body and attack a cancer from 360 degrees. And it attacks at the DNA level. And I guess it goes back to our first question from Cynthia about how do you incorporate all of these issues that are bombarding us at the moment. And specifically with affordable health care. We also have a tax on EPA where Clean Water, Clean Air, CERCLA, RCRA, Marine Mammal Protection Act, that as the time goes on is going to in itself cause further deleterious health effects. And so my question is, right now, what are the non-negotiable elements of Affordable Health Care, Affordable Care Act, from which we won't back away from, and which ones are the ones that were suggested by President Obama as areas that we could improve?
I'm not sure I got your last part. Which areas?
So President Obama, when all of this talk of repeal,
areas to improve. Okay.
he said, well, if you can improve it, I'm all for it.
Okay.
And so that's my
All right.
question.
Well, first of all, I'm so sorry to hear about your husband, and I'm
It couldn't be any better, and we are so fortunate to not only have access for health care through Kaiser, but also have something detected very, very early, which for this form of cancer almost never happens. Thank you.
Well, thank you. Thank you for the question. So to me, the non-negotiables are some of the things I just said about Medicaid, because if they cut Medicaid, they just want the money to give it away in a tax break to the very wealthy, okay? So they want to cut this program and use the money. So I think if we can get them off of this, maybe they will go back to focusing on things to do in the individual market. We are not going to accept any poison pill writers or anything related to trying to defund Planned Parenthood. We're just not going to do that. And it's been ridiculous how many times that we've had to fight for this. Literally, when we were, if it's a debt ceiling or the fiscal cliff or any budget deal, you would think that, our country and the markets and everything we're gonna, doom and gloom, and yet their big ask is they just want to get rid of Planned Parenthood. Now, Planned Parenthood has clinics, just like the gentleman mentioned, the clinic he represented, all over the state. And that's how people get access to health care, through that clinic. So if you say they can't get Medicaid funding, you're basically taking that clinic away from that community. We're just not going to do that, and we're going to fight every step of the way. So now you talk about what did President Obama say about what are other ways that you can improve. Okay, so another thing, again, I learned from everybody here, the great work in our state, and one thing that we did in the 80s and the 90s is we did something because we thought it was good for our state and for our people. We said, let's build a community-based infrastructure to get people off of nursing home care and get community care instead. First of all, people want to stay in their home longer, right? They want to stay in their home longer. It's a lot less expensive, okay? So we did that, but it meant building a network in our state to do it. And so we did this over a 10 to 15 year period of time. We saved $2 billion. $2 billion on this. So I wrote into the Affordable Care Act. I said, now, you have to remember, the Affordable Care Act was written at a big time of an economic downturn in our country, and no one was just going to volunteer to do this. So I said, let's incent. Do you mind, can I geek out for a minute? Okay. My staff is probably mortified. They're probably mortified, but I don't care. Okay. So I said, we will put some money in the Affordable Care Act if you will do the same thing that we did in our state. If you will work to rebalance off of nursing home care to community-based care. Now, why did I think that was so important to incent? Well, it was important to incent because, first of all, we have a huge population that's living longer. We have baby boomers that are retiring. We are going to see increased costs here. So having more affordable care in our communities is going to be key. Well, look at the states in blue that took me up on that. Okay, Texas, Arkansas, Mississippi, Kentucky. There are a lot of states that are Republican territories. They took the federal dollars to try to rebalance. Now when I talk to some of these people, they act like they don't even know what I'm talking about, okay? But I've said to them, if Washington saved $2 billion doing this, think if the whole country did this. We could save $100 billion, okay? And quit beating up on Medicaid and give us better care at home that we are going to want. So I know it's a little geeky, I'm sorry, Dr. Ramsey, but I am going to talk until I'm blue on the Senate floor about this, because this is where real savings can come from. And the notion that the other side is trying to scare the American people into thinking that this is the only way that we can get anywhere with health care is by cutting people off of Medicaid. Start focusing on a patient-centered system that lets people age in their homes. That is a better solution. Sorry. Okay, who's next?
Hi, Senator Cantwell. I'm Jalaire Box, and I'm with Speak Out Seattle as a volunteer. I thank you so much for coming today.
Thank you.
Really wonderful to have you here. I'm speaking about, today we're talking about drug consumption sites, also known as safe injection sites, that haven't really touched the federal level, but I know that Dean Ramsey knows something about them. On the King County and City of Seattle level, King County Public Health has the authority to make changes to health as they see it affects the public health of the region. And they have chosen with the King County Opioid Task Force to move forward with the concept of having people come into 2 pilot sites costing $5 to $6 million over the course of 3 years to inject heroin, snort, smoke, methamphetamines, and whatever other illicit drugs that they bring in themselves. And Speak Out Seattle is opposed to drug consumption sites, which is unusual in this group, but we feel as if that enhanced needle distribution programs, which were identified by the U.S. Surgeon General in a report last November 2016, to be more effective and evidence-based in reducing HIV and HCV transmissions. And there are a number of other reasons. I'm looking at the word incentive as well, in terms of Manchester, New Hampshire, having the opportunity for people, all of their fire stations are open. And when someone has that window of opportunity where they've had enough and they want to find detox and treatment, all of those fire stations are open, and their success rate at getting people into detox is 54%. And I like the idea of that, where someone takes that step themselves. And I wanted to ask, have you had any discussions at the federal level about this type of thing? Because I know the idea's been rolling around in some of the cities and states and counties of the United States, and it's not legal in the United States at this time. Thank you.
Thank you. Well, the opioid epidemic is something we need to fight tooth and nail, and I will gladly look at this. I don't know of a discussion that we've had about it at the federal level, but obviously the needle exchange program has worked well, and if this you think is a continuation, we'll look at this information and get back to you.
2 more numbers, 913280.
Keep going.
133653.
Need a couple more.
One more number, 913287.
My name is Patty Hare, and thank you so much for being here on behalf of West Seattle Indivisible. And Tommy, thank you for everything that you do for us as well. Your associate, he's great. Yeah, yay, Tommy. Okay. Just wanted to ask a couple questions. Well, one question, but it involves a couple parts. I just recently got laid off from my job and was on COBRA, and that ended. And I'm 53 years old and having difficulty finding a job again. So I currently, right at this moment, have zero insurance and not really sure what to do. I also have a 24-year-old daughter who graduated from the University of Washington with a degree in marine biology that has a job making $12 an hour and doesn't even make a living wage. So she's on the Affordable Care Act, so I really worry about her. She's so worried that she goes to Planned Parenthood, that she got an IUD because it lasts 6 years, because she's afraid she won't be able to get birth control next year, which is great that she has family planning, but it's still a weird thing to have to push. So my question to you is, what do we do as people that make too much money to get affordable care, but don't make enough money to actually buy insurance? Like, it's either car or insurance. You know, it doesn't make any sense. You have to be in complete poverty or be incredibly wealthy and have a lot of disposable income if you're self-employed or early retirement or unemployed. And so my question is, what do we do with that, the tweeners for that?
Well, that is why. Well, first of all, we'll be glad to help any way we can with where you are today. But for the future, this is why I think it's so important that we go back and focus on the individual market, and we focus on solutions like allowing people to be bundled up together in the basic plan. Now, I don't know if you think you could afford, and I don't know your income rate. I'm not asking you to reveal that to everyone here. But in New York, they have found that they can give an affordable insurance coverage to individuals, just as we had with the basic in our state. And I think there were a lot of people in our state who were in the same kind of situation that you were. Maybe they were working or not working, and that was a ready-made opportunity. That's what we need to get back to. So we should go and have that discussion in Washington, D.C. to make sure that people understand it's this part, this slice of the market. Now, why do I keep harping on this? Because the basic plan, if we got it, not just in New York and Minnesota, but here in Washington and other places in the United States, that bundled up market could get a more affordable rate. I would take it to what is, you know, a higher income level. It could end up taking care of the majority of our problem in the individual market. Literally, most of the people in the individual market. So that is why it's so important that we have this discussion. I'm going to say to my colleagues on the other side of the aisle, it's also going to save the federal government more money, okay? It is going to be cheaper for them. It is a model in which everybody is giving a little and it works economically. So I'm hoping that I'm going to convince some of them to come over and realize that this is the solution.
Senator Cantwell, I really appreciate your being here tonight and sharing everything you're doing. Many of the things you've shared tonight I was unaware of, so I really appreciate that. One of those that you shared tonight is the basic health plan. My concern here right now, I'm very concerned about the individual market. As you know, Regions Blue Shield is pulling out of most of Washington. My family is affected. Between my husband and my daughter, they are each facing life-threatening illnesses that require constant care. So as a mother and wife, I am petrified that we're going to lose our health coverage right now. I don't know when your basic plan might come into existence, but we also know that Republicans are doing everything they can to sabotage the individual market as we speak. So what can we do? The options for my family look very grim. I am, like I said, very nervous, very scared for them, and I know you're working to get that basic plan in, but is there something that this state can do now?
Well, one thing we can do is make sure we don't throw away the Medicaid safety net, okay? because that is a safety net that exists now in the sense of the coverage of people. If something happens to them and they're unemployed or they lose their coverage, they can get coverage through that. It's also the structure that we provide at the clinics. So if people, as the woman was saying up here, her daughter goes to that clinic, that is how she goes to that clinic. So that's the safety net for now. And so I want to make sure that is there and that we continue to improve and make sure that we have a cost-effective way to make sure individuals get the clout that they get if you worked for a large employer or were bundled up in a plan. Now, I will just say this, on the other side, that's not such a great idea to say, oh, well, their idea is we're just going to allow every state to decide and diminish the essentials that are going to be provided to you, so then you would just have a plan that didn't have very much coverage to it. I don't know if there's anybody here from our insurance commissioner's office, but I'm sure they would be very against that concept. So the concept is, how do we give you individuals clout just like other people do if they work for a large organization? So you deserve the same kind of price discounts that they get. That's what I wanted to make sure happens.
I'm Joanna Cullen. In the United States, it seems like there's been statistics that show most people support single payer. And I'm wondering if you would support Medicare for all, for instance, and what you see as the obstacles to getting there.
Well, I think it's very important that we continue to push the models that are going to help drive down costs and increase access. And what people may not realize that in the Affordable Care Act, we have a provision in there that says that a state can pursue actually using the federal dollars, a single payer system. That is the fastest way at this moment to get what you are asking for. Now, I'm just saying, it's not likely that with the Republican-controlled House and Senate and White House that we're going to get anything new done right now on that issue. But states can, under the Affordable Care Act, if we preserve it, if we fight to preserve it like we're doing right now, if we're fighting to preserve it, a state can pursue that as an option. You can support the bill when it comes to you. Yeah. Well, you can support this bill that's coming to you. Well, so I'm for the results that we've gotten on the basic health plan, because right now, 650,000 people in New York buying cheap, affordable insurance, which is a public option, has been a godsend. Now, if we can do better than that, I'm all for doing better than that, but at this point in time, we have people just like this woman up here saying, what can you get me today? Or what could you get me in the next year? And so I'm just laying out the path that we can move forward to give people access today.
Two more numbers, 913290 and 133666.
Hi, my name is Joe. I'm with the Washington 8th District Indivisible Group. Okay. And I'm nervous as hell. I just wanted to say thank you for holding the town hall, which my representative refuses to do, Dave Reichert. All right, my question to you is this. Will you commit to resisting any GOP healthcare proposal that reduces the number of people insured to give tax breaks to the wealthy by using all procedural tools at your disposal, including withholding consent and filibustering by amendment? And could you explain those, please?
Well, it's so important to make sure that we get this right and not get it wrong. And I just appreciate everybody here tonight and their enthusiasm on that, because I'm telling you, this is a battle. It is truly a battle. There are ways in which they're going to continue to try to proceed, but you can count that I'm going to be there every single day, every minute, with every tool possible to stop them from taking away health care from millions of Americans. So.
Hi, thank you for coming. My name is Charlene Mines, and I'm wondering, and I would hope it would never have to come to this, but what is the possibility or feasibility that like-minded states might get together and proceed on their own to develop health care for all of their citizens and leave what's going on behind?
Well, I like that flexibility, but I really think that we should keep pushing it. I mean, the notion that here in the Pacific Northwest, we literally deliver better care at lower costs. Now, you can, maybe Dean Ramsey might let him have a minute to say why that is, but it's been an anomaly that's existed since about the 70s. And because of that, we have delivered more innovative, more efficient ways to deliver health care. And so when you're talking to Oregon, or you're talking to people here in Washington, or maybe some of our other neighboring or nearby states, they get how you continue to proceed together on driving down cost and increasing access in great, great ways that we've just been talking about. They get it, it's like secondhand to them. And the rest of the country is a little bit on fee for service. I don't know, how many people do you know what that means? So like when you go to the doctor, they're just going to write out, this is how much this is, this is how much this is, this is how. That's not the way the Northwest is. The Northwest is about delivering access to care. Basically, we deliver better care at lower costs. So we also wrote this into the Affordable Care Act that said the whole country, I wrote this provision, the whole country should shift to doing health care like we do and have an index that rewarded you for delivering more access to care. You know, on the East Coast, it's a little harder to convince them about this model. That's why I'm saying Dean Ramsey might have a minute or two, maybe at the end. Anyway, the struggle, I'm just telling you, it's Herculean every day to make, okay, when Mr. Price, our now health secretary from Georgia, a congressman, and a member of the medical profession, a doctor, when I asked him about that rebalancing, even though Georgia had taken the money, he didn't even know about it. And when I asked him, well, what about the concept of rebalancing, he really wasn't even very enthusiastic about that. So I'm with you. If we can bundle up states together that can form an even larger market and drive down costs and save money and do all of those great things working together, I am for it. I am for it.
Two more numbers, 133663. 913907. Try a third. 133667. While the microphone is being carried up the stairs there, 913916.
Go ahead, Joe.
My name's Kate McGann. I'm a retired social worker and now work part-time in a mental health agency. I have a dear one who has incurable cancer and is on the expansion. And I think my questions have been answered because it deals with that pocket of people in there that would be helped by basic health care. I remember basic health care and being in management at that time when it was in. It was great. And so I plan to go home, get on my Facebook, and do basic health care.
Oh my gosh, thank you, thank you, thank you. You have made my evening with that. You have made my evening. I will just say that I thought when we got this into the bill, I didn't think it'd be so hard after that. I thought, okay, this is great. But then we had to fight to get it implemented. And then since then, we've had to fight to make sure that people really understood what it was doing. And now sometimes I feel like I'm talking Greek. I say to people, 650,000 people in New York, and they got it for $500. Why wouldn't we want to do that? It's just, I think people are so bogged down on the fight that we're having right now. They're not looking for solutions. And I think if we can get them off of this debate and help some of my colleagues, I'm hoping that my colleague from Louisiana, Senator Cassidy, who has shown, he's basically said states should be able to do what they want. I'm hoping that he might take a look at this and become an advocate. But thank you so much.
My name is Ben Anderson. I'm a cancer surgeon here at the University of Washington and Seattle Cancer Care Alliance. First, a thank you. When our son was 24, he was diagnosed with Burkitt's lymphoma. He would not have been on insurance had it not been for the Affordable Care Act. And UW saved our son's life. My wife became critically ill halfway through that process, and Dean Ramsey, I just need to say our system is awesome here in terms of the care we provide. My question is that the medical organizations, to the best of my knowledge, there is no medical organization that has come out in favor of the current bill. And I don't understand why that is not being emphasized more. When my car breaks, I go ask the guy that fixes my car, what do I need to do? I don't ask the banker that gave me the loan. So, why is this not being emphasized more at the level of Congress to talk to the people that actually understand how the system works?
Listen, I have read the list in entirety of all the organizations who are opposed to this bill that is now on the Senate floor. So I have made that point, and I've encouraged my colleagues, as I said earlier, to come down and debate, because I think if they came down and debate, we would say to them, who's supporting this? Who's supporting this concept? Who are the people that think it's a good idea? You're right, there's nobody in the healthcare field that thinks what they're proposing is a good idea. So I couldn't agree with you more. We're going to try to keep emphasizing that, and we're going to try to keep emphasizing what we think are solutions. So thank you for that question.
Senator Cantwell, I should note that Dr. Henderson's number was selected by random. He was not.
Well, I thank you for the great service that his family got.
Two more numbers. 913917. 913917. 133655. 913277.
Hi, I'm Naomi Rue from Seattle, and I have a family with everybody with pre-existing conditions, so I'm wondering, What will you do to fight for coverage of pre-existing conditions and essential health benefits?
Well, this is a key part. That was the Affordable Care Act. We should make sure that we're not going to try to dump access to care by cutting benefits or throwing people with pre-existing conditions out of the marketplace. We're not going to do that. So that is not the way to fix the system, not the way.
133679. Nine 313284.
Hi, my name is Liz Curran, and I'm here with Indivisible North Seattle. Thank you for holding this meeting. I think that it's really been beneficial to a lot of people in this country to hear these discussions, because obviously the ACA is a lot more popular than it was. And I think there's a lot more information that needs to get out so that people can continue to support it. And I'm really concerned mostly about the pre-existing conditions and high risk, because the Republicans are portraying the high risk as a viable option. My husband and I have a daughter who just turned 32 last week. When she was 27, she had a sudden, unexpected cardiac arrest here in Seattle. Training for a marathon, she was rescued by a firefighter trainee and was in the ICU at cardiac ICU at Swedish Cherry Hill for 9 days. She now has a defibrillator. She has a good job. She has good health insurance through Amazon. And while we were there hoping that she would recover, we wondered, what it must be like for people who didn't have good health insurance. However, as hard as she works and as expensive it is to live in Seattle, a good portion of her income has to go to covering her higher health costs. And I guess one of the reasons that and even though I've done a lot of administering in-house for health insurance plans over the years, and I've really come to the conclusion that we need universal health care for a lot of reasons. And one of them is that she lives a healthy lifestyle, but she has really high medical bills. And that just doesn't seem right. We need to make sure that everybody is covered and covered at a fair price.
Absolutely, absolutely. You are soft-spoken, but you said it very well. We need universal coverage, and you shouldn't be discriminated against because you have a health condition. You just shouldn't. And so that's the principle that we're going to fight for. So thank you so much for sharing your daughter's story.
Thanks, Senator Cantwell, for being here. My wife got the ticket, but she handed it to me.
I thought you were a little sheepish, but I couldn't tell what was going on.
The ACA, from what I understand, was the compromise with the Republicans, who ended up not voting for it, but we gave them all that time to add amendments and to debate this on the floor. And to me, the ACA is the line in the sand that I don't want to go back from. And I'm willing to do anything you ask me to do to hold that line in the sand and progress from there. So what do we do?
Thank you, thank you. Well, you brought something up that's not been emphasized as much, and that is literally during the Affordable Care Act, I think accepted 140 amendments offered by them. We had various, open process of legislation to amend that. There was a long time where both Senator Grassley played a key role in the formation, and then my colleague at the time, Olympia Snowe. So you're right. And so we've said this is what we should be doing, is going back to the regular order process, not, as you can see, writing this in, the dark of night in some room with 13 dudes from, not, like we should have an open process. So even though in the very end of that Affordable Care Act process, we didn't have Republican support, throughout that process, they had a lot of amendments, and that's what we should make sure that we're going to not do this in the dark of night. Well, that's what we're doing right now because of everybody's hard work. They didn't have this vote before we left, okay? But we're working hard now. We're working hard now because it's not a foregone conclusion that they aren't going to try the very day we get back. So we have to be loud. We have to do these things. We have to show them that they're wrong. We have to, look, I go down there to the floor to debate these policies and encourage them to come to debate. And if they don't show up, I think that shows that we are winning the debate. Because if they won't come and debate the issue, then obviously they don't think that they're on the winning side of that equation. So let's get back to the real problems.
2 more numbers, 913625. Right. And 133682.
Do you have them in your hand?
Jack Berg, I'm from Seattle. I've heard that you voted against a bill that would allow the importation of cheaper drugs from Canada, and another one that was essentially a single-payer bill. Will you explain, did you vote against those? And please explain what your philosophy was.
Well, it's very important that we drive down drug prices. Very important, very important. And if you've heard this discussion about what's impacting the individual market here, people will say drug prices. Okay, so in the language that we had previously, there was no safety for working on who was importing the drug and how we could verify that it was literally something we would feel comfortable people in the United States would be taking. So we worked with Senator Sanders and came up with legislation that put those safety standards in place. Now, what I really want is I want us to have the ability to negotiate on price with drug manufacturers just like we do with the VA. If we had that for Medicare Part D, we'd probably save 25 or 30%. That's what we should be passing, and hopefully we can do that.
Hello, Senator Cantwell. Thank you so much for being our senator. And my name is Rose Dennis, and I'm from Kirkland, Washington. And I'm here this evening as a voice for those who have the disease of addiction. And I have a son who's been fighting addiction for 18 years, was introduced to opiates when he was in the hospital surviving for his life against cancer, and left the hospital addicted to drugs, and has since chose heroin. So my question to you, and for all of those, and I'm a voice for those who have the disease of addiction, and my concern is, as a country, we know that a wall is not going to prevent drugs from entering our country. We know that mental health care is down. We know that recovery and all the programs to help those who are fighting addiction are not being supported the way they should. And my question to you is and I understand that mental health and drug addiction has been removed from the Trumpcare proposal, and I'm just wondering, what are we doing to get the drug dealers off the streets? What are we doing to prevent those to continue to want to use, and helping them get their life back together?
This is such a huge problem in the United States of America, and while we've authorized some support for a total range of support for individuals so that they can get treatment, we have not funded it at the level that it needs to be funded. So that's the next step. But just don't fall. All I'm saying is don't fall for what they're trying to do right now while we're here. I guarantee you that people are burning up the phone lines, trying to call senators saying, we'll put in 45 million, we'll put in 45 billion if you'll just vote for this bill. And as I explained earlier, was that a good diagram with Dean Ramsey? He's a provider. He gets a bunch of opioid money, but he's not going to see somebody. I don't know whether your son's on Medicaid or not, but he is. Okay, so Dean Ramsey will have a lot of money, but he's not going to see anybody who's not on Medicaid. Okay, so it's a false choice. So let's really fund the opioid addiction problem, get people treatment, and obviously help them with this very, very big scourge that's affecting America. Thank you for asking that. Go ahead, Dean.
133650. 913289.
Hello, Senator Cantwell. My name is Gina Kim. Jesus, I'm nervous. I'm running for city council here in Shoreline, and I'm doing, thank you, but I'm doing it open as a recovering addict from opioid addiction. And a few people mentioned the problem as well. But my question, Senator Cantwell, is I do have Medicaid, but here in King County, the only not-for-profit detox center shut down without any notice at all. We have 0 not-for-profit detox centers that accept any Medicaid. So with opioid addicts, we're at the, excuse me, Senator, I'm so nervous. We're at the very bottom of the priority list because alcohol and benzodiazepines are the only life-threatening withdrawal. So when I was trying to get into detox with Medicaid, they told me to drink a 6-pack because that would help me get in. And I didn't get in. I had to detox on my brother's floor. I am obviously in long-term recovery, Senator, but, and thank you for trying to protect it, but we can't send addicts to places that don't exist, even when they have Medicaid. I would hope to contact your office later about safe consumption sites because this year alone, I lost count after 8. In Seattle, we have 38. Every 38 hours, we have someone dying. And I don't know what to do except for run for office in my little 11 square mile city to try and make a difference, but there's only so much I can do. So, Senator,
we need more help with inpatient beds. We need more inpatient bed facilities that can help treat people. This can't be doing it on the rough, as you described what was advised to you. It's a very, very deadly and serious problem. And people, why do we have this problem? Why do we have the problem? Because people are highly addicted to it, okay? It's not something they're going to get off by themselves. They need the help and support of a facility, so we need to expand the number of what are inpatient facilities to do that. So.
Linda Clifton, and I want to thank you for being here with us and for listening so patiently and for having so many good answers. I want to go back to something you said about interstate compacts to have more bargaining power. And I'm wondering why that would be preferable to just having universal care through single payer.
I'm just saying, I'm distinguishing between what we can do right now and what will take us longer, that's all. So we're here tonight, and under the Affordable Care Act, it allows states to work together. So we could form, I mean, I find some humor in it because we're the ones with better health care at lower costs, and us working together would probably just show even more what we have as a system. So all I'm saying is we can do that today, that's all. Let's not hesitate. At the same time, I'm going back there and fighting all of these tactics where they're going to try to change this next week, okay? So my point is just to try to emphasize how we have to use all of this to convince a handful of them to keep saying no, okay? To say there are way better solutions out there in the marketplace. And believe me, I'd like to say to Alaska, like you, Washington, Alaska, Oregon, California, I'm sure we could provide better health care, I'm sure.
We have time for one more question and then some closing remarks by Senator Cantwell. 913272.
Hi, Senator Cantwell. My name's Elaine Colligan. I'm from Ravenna here in Seattle, Washington. And, you know, for the past couple of years, I've been working in electoral politics, and I've really followed, you know, the fight between Trump and the Democrats and seen what a crucial point we are here in our country right now. And my question is kind of looking forward to 2018 and 2020. You know, Elizabeth Warren said just last week that Medicare for all and the single-payer system, that Democrats should be campaigning on Medicare for all. And given that, you know, people are so worried about this issue in our country and that this proposal is really popular, do you think Democrats can win in 2018 and 2020 without supporting Medicare for all? And do you think, will you support Medicare for all?
I definitely want to get people having universal coverage. So whether you want to talk about the basic health plan or another avenue to do that, those are all ideas. We should look at how we can make sure that we're covering people, that they get the care that they deserve to get, and that we are going to do everything to make sure that it works for everybody cost effectively. I know there are ways to do that. I know there are ways to do that. So. Okay.
Since we started late, I'm told we have time for 2 more questions. So 2 more numbers. 913261. 133652.
Okay. Hi, my name is John Gannon from Newcastle, and my concern is mental health care. You made the point that this region does a good job on health care in general. I don't think it does a good job on mental health care. And one of the recent examples, I have deep sympathy for police, but too many times they're left with the problems that could have been solved by health care. So what can we do about that?
Yep. You're right. Earlier I was referring to our Medicare reimbursement rate and how well we deliver care with fewer dollars than other parts. You're right, mental health is a huge issue, and we need to do more. We need to make sure that people have coverage, and we need to fix making sure that people have stable places to live, and we need to make sure that people have available both in-bed treatment and community care to access that as well. One of the reasons that I'm fighting so hard right now on increasing what's called the low-income housing tax credit is because we have a housing crisis in our city. We have a housing crisis, and these individuals don't have a place to go. So we need to make sure that we're building more affordable housing, that structure gives people in-service care in those facilities, and make sure that people can also have greater access if they need it. in a stabilized facility. That's what we need to do. So I've been successful at getting 18 co-sponsors on that bill, 8 Republicans, 10 Democrats, and I'm not going to stop until we build more affordable housing here in Seattle.
Hello, Senator. My name is Jamie Margolin. I'm 15 years old, and I've been spending most of my time after the election lobbying, doing a ton of political advocacy and more lobbying. Healthcare really ties into environmental issues because of the climate crisis and because of all the pollution crisis that we're having now. Asthma rates and lung cancer rates are skyrocketing, and just all the toxins that are everywhere are just causing all sorts of cancers and diseases to skyrocket. And as a 15-year-old, I'm really terrified for my future because of the climate crisis and because of also warming temperatures mean that more tropical epidemics are going to come up north. So that's also very scary. And while we're thinking about health, I think it's important that you do no more business as usual when it comes to the climate crisis, because even if we can resist absolutely everything that Donald Trump does, absolutely everything that the administration does trying to slash environmental protections, we're still where we started off before, which was a very bad place. And so this is an emergency. I don't know if you senators can call some emergency meeting or something, gathering on climate change and on this, because the health repercussions are gonna be awful, and there's really no more time to dilly-dally. And so I'm just wondering, what extreme measures on climate are you gonna take, apart from just trying to stop what Trump does? Because even if we stop everything he does, we're still at a sucky place. So,
well, thank you for the question, and thank you for your enthusiasm. And there's always openings for interns to come to DC and work. Right now, one of our biggest challenges is that his budget proposal decimates science and research and everything we care about as it relates to this. We have ocean acidification here, killing our shellfish. We're having impact on our sea life. The oceans are becoming a big sinkhole for this level of carbon. It's a disaster. So we have to fight. Right now, we're going to have to fight a budget. Last week, I had to fight the Energy Secretary and the Interior Secretary, okay? They both have bad ideas as it relates to what they are trying to do, and how do we stop them? So, it's all of these things. It is very challenging when they roll over you and no one knows. I want us to mobilize, and the best example I can give is what happened when the outdoor industry. So one of the things they're also trying to do is roll back access to federal lands. They want to take things like Hanford Reach or in Utah and give it back so that they can have oil and gas exploration. So I am fighting that every step of the way. But I feel like so much of it is getting lost. So if you have any ideas of how to get this into the mindset of every American, I will be so grateful, just like this woman's going to go home and blog about the basic health plan. What the outdoor industry said is, if you continue to pursue rollback of federal lands, we're leaving Utah. We're not going to stay here and have our conference. And even though that was worth about $40 million to them, what was more important is that it caused such a debate in Utah. Okay? And what I want to create is a debate all across America about the bad policies this administration is pursuing against our climate. It is not sustainable. We need to do everything we possibly can to expose them and to fight this, and hopefully get a handful of senators to help us stop these bad policies, and if not, use the courts every step of the way to stop them. So that is, for the last 2 years, we have led the fight on what was to, basically we're giving away coal off of federal land at a very cheap price, and it's causing all of this pollution. So I said we need to recalculate that and stop giving it away without really taking into the consequences of all the pollution that it's causing. And Sally Jewell was on her way to redefining that and actually charging the industry what they should be charged. This secretary is throwing that out. And we are going to fight him with everything we have to make sure that he does not allow them to continue to get off on the cheap with polluting and not paying for the pollution that they're causing. So thank you very much for that question. Okay. Well, thank you all very much for coming tonight. I know we didn't get to everybody, but please do this. If you didn't get a question answered, and if you want to write one down, we will try to get it answered for you. Secondly, we're having another meeting. Let's see, where is this? We're so fortunate that FCC Commissioner Clybourne is coming to town. One of the other efforts we have to worry about, I'm sorry, I know there's a lot to worry about right now. There's a lot to worry about. The FCC is considering a rule to roll back the net neutrality laws that stop from throttling the internet. I know, so we don't want them to do this, so she's so generous to come. We'll be holding a town meeting this Friday at 7 p.m. 11 to 12:30 at Town Hall here in Seattle. And then we have another town hall on Saturday in Burien, White Center. All right, thank you all very, very much. I so appreciate you being here. Thank you, Dean Ramsey. Thank you, University of Washington. Thank you, Washington residents. Thank you. Thank you.